Pa-expound lang sana namin yung binanggit nyo kanina, yung rehab plan for the medical sector ng Marawi. Yung 2 years na magdadagdag kayo ng tao.
Yes, oo. Because that's a commitment of national government, Build Back Better. We're laying out a rehabilitation plan for Marawi that is close to the ideal of the Cuban model of health system. So, yun nga, one barangay health station per barangay. There are 96 barangays in Marawi and 1 health personnel per barangay. 1 rural health unit per every 20,000 population. Currently, there's just about 4 in Marawi and kakailanganin siguro mga 10 or 12. And then we have 1 lying in or polyclinic for every 50,000. This facility we don't have in the country. That is the strength of the Cuban health system. So there will be about 4 that will be built kasi 200,000 yung Marawi. And then for the hospital, 1 bed for every 800 population. So we'll be upgrading our medical center, the Amay Pakpak Medical Center, for 500 beds.
You will require recruitment for this upgrade.
Yes, of course.
How many people are we looking?
Hindi pa namin na-calculate, but I think we'll add about 200 to 300 personnel for the entire Marawi.
Timetable, ma'am?
Ang ano natin, we'll support it in the meantime with national government hired personnel. And then after that, we hope that the local government can take over through, of course, we're looking at PhilHealth reimbursements to actually make the health system sustainable.
Sustainable. Funding.
Ay yung
projection, budgetary requirements.
Pag national government, that will be funded by the DOH, and we have already in the pipeline in our budget for 2018 the deployment program. So we hire nurses, doctors, medtech, pharmacists, dentists, lahat po yan. Ang gagawin lang po namin, instead of deploying them in other areas, we'll deploy them in Marawi.
But in the amount of?
Hindi pa namin nakakalculate.
Wala pa sa
Wala pa, yes.
Pero
yung nakalculate lang namin is infra budget.
Pero this will be in GAA?
This is already incorporated in our budget. So, nandun na yung budget na to. Instead of deploying them, for example, to Tarlac or Pampanga na marami namang access yung mga tao doon, we'll deploy them to Marawi. Okay.